Hello, this is Senator Ben Cardin, and welcome to Facebook Live, an opportunity that I take advantage of every so often to communicate with the people of Maryland on timely subjects that are taking place in the United States Senate. And today we're going to talk about the COVID-19 vaccine, the distribution system, the importance of vaccinations, where we are in controlling the virus, and what more we can do in order to make sure that we all are safe. I have two outstanding experts who have really given their lives to public service with me today. So I'm very proud to have them on this broadcast, but also because I can publicly thank them for their public service. Dr. Josh Sharfstein, who is the Vice Dean, Public Health Practice and Community Engagement at Johns Hopkins University, and he was the former Secretary of the Maryland Department of Health and the former Deputy Commissioner at the United States Food and Drug Administration. So it is a real expert in this area. I also am very proud to have with me a frontline worker who's been incredible in public health in our community, Dr. Ernest Carter, who is Prince George's County's health officer. And we all know the challenges today in being in public health. So we got two experts. So I want to start by talking about the roles that both of you have played. Josh, I want you to know that Johns Hopkins is the gold standard on information being used not just in Maryland, not just in America, but globally. They have stepped forward, and their numbers are considered to be the reliable informational numbers in regards to COVID-19. Just talk a little bit about your current role as Vice Dean and where Johns Hopkins is playing a role in trying to deal with COVID-19 globally.
Sure. Well, thanks so much for having me. And thank you, Senator Cardin, for your incredible record of leadership on health for so many years. It's made such a difference for so many people in Maryland. And it's great to be here with Dr. Carter. I'm such a big fan of his work in Prince George's County. I have had it's been a remarkable year at Johns Hopkins. You know, a century ago, Johns Hopkins was very involved in the mobilization for the Great Influenza. And then here we are with another pandemic, and every part of the university is engaged in one type of work or another. You mentioned the map, which has had billions of views, and there's a huge team and a lot of scientists who work with data, who are working with the map. Just today, I think on the front page of the New York Times is a new tool that was developed with the New York Times and Resolve to Save Lives from Hopkins that allows people to look at their county and get a lot of specific information and instructions based on their county. In addition to the data work, there's a huge policy presence with all reports on all these different issues that come up, from schools to vaccination policy. There's an enormous outreach component in the Baltimore region with many different events. For example, just last night, Dr. Corbett of the National Institutes of Health spoke with hundreds of community members asking her questions about the vaccine that she helped to develop at NIH. Personally, I've been involved in a number of these different efforts at a small scale. My main work has been in advising local leaders, health leaders, and elected officials. I just came off a call with more than 150 mayors, which is a meeting that I've had almost every week or every few weeks since March through Bloomberg Philanthropies. And I speak to the mayors in general on different topics. And then I work with them individually as different questions come up for their areas to try to help them under very difficult, not just public health conditions, but also political conditions in different parts of the country right now.
Well, thank you for that. And we really appreciate the work that you do and Johns Hopkins has been doing to help all of us. So we talk about frontline workers, and when we have issues at the federal government that we want to pass down, we pass them down to the states. When the states want to deal with a problem, they pass it down to the county. The county has no place they can push it off on. They are the true frontline workers. And when we look at the true frontline workers, it's our public health officials in our counties. And we are very fortunate in Maryland to have Dr. Carter as the Prince George's County health officer. Can you just tell us the challenges that you've had to confront in public health for the people of Prince George's County?
Well, thank you so much, Senator Cardin, and it's an honor to be here and asking me to be here, and it's an honor to be with you with your service to the country. And I know this is a tough time, and we're looking forward to the Biden administration helping us move forward. And it's also being here with Dr. Sharpstein, who has paved the way here in Maryland. And I'm really just following in his footsteps, trying to be sure that I can protect the public, because that's my primary goal. And with the COVID virus has been a challenge for us, and it's been a challenge as it has been for everybody. In public health, especially health departments that are in counties like myself, the challenge is that the resources you have to have, the staffing you need, and just to be able to convince the public that this is a serious threat. And from the very beginning, that was the biggest challenge, to let people know that you have to stay 6 foot apart. You need to put on a mask. You need to understand the seriousness of what's coming at you with this virus spreading. And from testing and setting up testing sites to doing the contact tracing to be sure that people who have been exposed are isolating correctly, to setting up quarantine sites, to making sure that industries and essential places like grocery stores are following the rules for social distancing. It's in enforcing those rules and making sure that our citizens understand why we're doing it and the importance of protecting them. That's been a challenge. However, our citizens have stepped up to the plate. I mean, they have done what they are supposed to do. And in this tough time, while we're getting to the promised land with the vaccination, we're continuing to educate and communicate. Communications, as you know, in a pandemic is the number one thing you have to be able to do. You can have all the vaccine testing in the world, but if you don't communicate clearly and make people trust you, basically, that's the most important ingredient. And it's the trust barrier that we're working on right now.
Well, thank you. And we really do appreciate that, because trust is so important to getting this virus under control. And as we are broadcasting, we are still at a plateau high level of the coronavirus in our community. Over the last several months, we've been averaging a couple thousand new cases a day. We've been averaging dozens of deaths every day. And we know the national numbers, as the President Biden talks about being at a war against the virus with over 400,000 casualties, deaths. We recognize that we still have a long way to go to get this COVID under control. So knowing that, our scientists performed miraculous service in developing vaccines to deal with this COVID-19 virus in record speed, no question about it. And now we're in the process of getting people vaccinated. And I want to cover this in a couple different ways, but I want to start first with the importance of getting the vaccination. We know that there's risk involved in whatever you do. People do get reactions to vaccines. We also know that certain individuals have certain allergies and certain reactions that are more predictable than others. So what is your medical advice as far as the relative risks are concerned, or how an individual knows whether he or she should consider not taking the vaccine because of a high risk factor versus reward? Can we just talk for a moment as to why a typical person in our community should be vaccinated? Dr. Sharpstein.
Sure. Well, I think you asked the right question there, Senator Cardin, which is, how does getting the vaccine compare with the risks of not getting the vaccine? We know that COVID is a very serious illness. We have people dying, thousands of people every day in the United States. And we also know that even people who have mild illness can have lasting effects. They can be very tired. They can have headaches. There are all kinds of, patients now who are trying to figure out what damage the virus did to their body. So it's you don't know what's going to happen. For some people, it's very, very high risk, but even people who are low risk can wind up losing the lottery and getting quite sick or having long-term complications from COVID. So compared to that, we have a vaccine that's very highly effective with 95% reduction in cases of COVID and equally very strong reduction in cases of severe COVID. And at the same time, a very generally mild to moderate, side effects, which happen very quickly. So meaning you get a little bit of a sore arm, or people feel bad for a day. So maybe they don't feel so well for a short period of time, but then people feel better, and then they're back to themselves again. The risk of an allergic reaction is really the only serious risk that's been identified through tens of thousands of patients getting vaccinated. And that risk is very small and it's treatable. So it's between 1 in 100,000 or 1 in 500,000 people may get an allergic reaction, which then gets treated, and nobody has died from an allergic reaction. So you have, on the one hand, you have the risk of very severe infection, maybe death, maybe long-term consequences of COVID. Compare that to, the effects of the vaccine working. You have a sore arm, or you get a fever for a day, or something like that. Pretty mild with a tiny chance of a treatable allergic reaction. It's really pretty easy to see the value of vaccination there, protecting you against those serious harms from COVID.
Dr. Carter, you mentioned the credibility with the community and confidence with the community. The minority community has experienced such discrimination in our system, including on the administration of vaccines. What is your message to the minority community as to whether they should have confidence in the system to take the vaccine, recognizing that when you look at our healthcare system generally in this country, there is systemic racism. When you take a look at access to care, there are challenges in minority communities. Why should they have confidence that the information they are receiving to get the vaccine is really in their best interest?
Well, the first I would say, Senator Cardin, and to all of the folks out there who are looking at how to best serve the minority community, what we have to do is make sure that, and again, you have to have the trusted individuals from that community understand the science behind the vaccine, why it's safe, and why it's efficacious. Once they develop that confidence, and that the community leaders who can understand those same principles can communicate that well, then I think that what will happen in minority communities, people will take the vaccine en masse. When I first started talking about the vaccine, I told most of my audiences, if I didn't forget, that I told them to be sure when the vaccine comes out, watch what I do. If the science is not good, if it's not efficacious, then I won't take it. But if the science is good, and if it's efficacious, and that I know it's going to help your family, save your family members' lives in the end, especially your seniors, then I'm going to take the shot. So I took the shot. I got my first and second dose. It's not only important that I show that I take the dose, but those people who are the leaders in the community take the dose. This is a person-to-person trust issue. The biggest billboard in the world won't make somebody in the minority community take the vaccine. But the person who will be able to do it is their immediate family member who understands, who can explain it, the person in the barbershop when you're getting your hair cut, and miss all of the myths that are floating around the community. The other thing that has to be dispelled is that the distrust factor comes from the previous history of what's happened to minorities in the country in terms of being vaccinated. And I mean, just the medical system in general. But I think that doctors like myself and other doctors who work in the community and who know how to communicate with minority patients and can make sure to gain their trust, I think that's the way it's going to really occur. In the county, of course, we have a trust campaign. We have these type of town halls. we do all the communication things that we need to, but it's going to be one-to-one. It's going to be in family gatherings talking about why this vaccine is safe and why it should be taken.
So it seems to me that all eligible people in this country for the vaccine should get the vaccine. The risk factors are pretty clear that it's in their interest to do that. As you get the vaccine, they're going to ask you to wait 15 minutes, because the reaction is generally, if there's going to be a severe reaction, it's generally understood within that period of time, and they can treat it, as Dr. Starkstein has said. I would expect the only exception would be that if you have a particular circumstance that your doctor advises you for a different course, then obviously listen to your doctor. But other than that, the vaccine is safe for all to take. Now, there are two vaccines that are on the market at the present time, Moderna and Pfizer. They both require 2 shots between, I think it's 3 to 4 weeks of difference when taking the first and second shot. As I understand it, each dose is identical, so it's not a booster. It's actually 2 doses you're getting of the same vaccine, but it's neat for maximum effectiveness. And we expect there may be other vaccines available. Johnson & Johnson hopes to have a single dose vaccine available. So from the information that has been made available, is it in your interest to try to get one vaccine over the other, or are they all kind of comparable from the point of view of their effectiveness? Dr. Sharfstein?
Yeah, there's no difference between the two that is known. So they both were very highly effective in clinical studies. And just worth mentioning that these are the clinical studies that involve tens of thousands of patients. They're as large as pretty much any vaccine study. There were no corners cut for these studies, and they both showed 95% declines in the chance of getting COVID-19. And so either one is great to take.
And Dr. Carter, it's important for people to be vaccinated to protect themselves, but it also protects our community, because as more and more people become vaccinated, we have a chance to get this virus under control. So as part of the messaging we need to do with the American public, with the people of Prince George's County or Maryland, is that do it for yourself, but also do it for your family and community. Is that accurate?
That's very accurate, because when we get up to a certain point where enough people are vaccinated, then the COVID virus just doesn't have anywhere to go. It can't spread nearly as well as if you have people who are not vaccinated. And they call that herd immunity. There's a certain percentage of folks who have to be vaccinated so that the virus just doesn't have a chance to spread. And when it doesn't have a chance to spread, then it can't get to our vulnerable populations. It can't get to the point where it wants to mutate a lot, because it's spreading so much. And that helps us to decrease the number of people who get sick from it, who ultimately get hospitalized from it, and then people who ultimately die. So you're helping your neighbor. You're definitely helping your neighbor by getting the shot, not just helping yourself. And we're all in this together. This is one of those things where it's a collective. We have to do it as a collective in order to help all concerned.
So we have a question from Marlene on Facebook Live, who wants to know why some people get a reaction and others don't, why some people don't have a reaction on the first shot but get a reaction on the second shot. Why is there a difference here?
Well, in general, the reactions, those temporary reactions I mentioned before, are more common with the second shot, and they're more common with younger people. And it probably has to do with just for the second shot, because you have had the first shot, your immune system is a little bit ready to jump on that second shot and get stimulated. So you feel that stimulation a little bit more. But why for younger people a little bit more than older people? It may just be that their immune system is more active. And again, it just reacts stronger to that second shot. But the important point here is everyone, no matter what kind of effects, whether they just felt a little sore arm or they had a fever, responded very well to the shots, 95% reduction. So it really didn't predict whether or not, people are protected or not. It's just how our bodies respond to the shots. And there's no connection that's known between those two things. And I think the most important thing is for people just to be prepared. You may feel sick for a day or two, but then you're going to get better, and then you'll be protected.
Dr. Carter, I want to preface this question first by complimenting Prince George's County. As a state official, I hear from people all over the state. So I get people's reaction to how they are handled on trying to get appointments for vaccinations. And I want you to know that Prince George's County has ranked as very high in the response and politeness and the way that appointments have been set up. It doesn't mean there aren't complaints, but there's been far more satisfaction in Prince George's County than many of the other counties in Maryland. And I also want to preface this question by saying there was a real failure at the federal level to have a COVID-19 policy, a policy on what is the right public health procedures to follow consistently, a policy to make sure we had a reliable source of the vaccines, as well as the other important parts of getting COVID-19 under control. There was inconsistencies in how the distributions would be done once they reached the state. In fact, there was no guidance as to what was going to happen after they reached the state. And the state didn't know exactly how much they were going to receive and how often they were going to receive the vaccines. And who should be on category 1 and how you define category 1. And the list goes on and on and on. So there was not the federal direction that should have been there. I think President Biden and his administration will change that. I really do. And then the state had a significant role to play in determining priorities and local distributions. And admittedly, it was a challenge for the state, but they are, to this date, have not been as transparent as I think many of us would like them to be, including with local officials. So I preface this question by saying this has been a real challenge for a county health officer. But there's a lot of frustration out there in the public that people, some are able to get appointments, others have not been able to get appointments. Some don't understand why this person qualifies here, but maybe not in some other counties' interpretation of who is a frontline worker. So what is your answer to the people of Prince George's County in Maryland as to the process being used now to guarantee its fairness, that everybody's being treated fairly, that no one can jump in front of the line? Are you confident that this system is working the way it should?
Well, I think what we have to be, and what I ask the public to be, is patient, because there are several factors that go into having an adequate distribution system. And unfortunately, there was no playbook, as you just described. There was zero playbook. The states didn't have a playbook. The coordination in a region between states, and that drills down all the way to the county level, there was no real playbook. So at the time, and as we go through the time of vaccination, we want to be sure that we stay equitable and fair. So you want to be sure that when you distribute the vaccine with an extremely limited supply, you do it in an equitable way. So you definitely want to vaccinate your vaccinators first, your frontline workers, but then you also want to try to get right to the heart of where folk is impacting people the most, which would be in nursing homes and assisted living facilities. And then ultimately, the folks who have to work not only on the front line, but the people who have to keep the system going, they can't get out. You can't lose them. So you need those folks. But then you need people that, as you go down the list of folks you need to vaccinate with a limited supply, you've just got to be sure that you're getting those people who are the most vulnerable, who would be in the hospital, who would end up sick, with over 75 years of age. And that's the thinking, and it goes like that. It goes all the way down. And there was a lot of thought, I believe, given, especially in our state, as to how that should be structured. And then the biggest challenge that the state has is this extremely limited supply of vaccine. So who gets it first? We have to make sure that, of course, our frontline workers and vaccinators, but then we've got to be sure that as more vaccine comes in, we can distribute it equitably. So we can be sure it does get into the African American community in a way that's equitable, as well as we distribute it across all of our communities. So it's not a playbook. And I do think that the people in our community, they've been patient with us, and I trust that they will be, because the systems that we have, in particular, the systems that signs you up to register for the vaccine, was not made for a pandemic. It wasn't made to handle a system this big, these many people trying to register, trying to get a first and second dose. So we're working with it as well as the state. The state is good partners to the county, but we realize the difficulties that they have. It's just a difficult process. But I have every confidence with the Biden administration. We see the light at the end of the tunnel. We see how this is going to work. So I think if our public just is patient with us a little while, we'll be okay.
We have another question from the audience on Facebook Live that I think is an interesting one. And then I want to get to the system, back to the system again. And this question says that, maybe I missed my second appointment, emergency comes up, or they run out of vaccines that they oversubscribed on a given day, which can happen also. Do I have to start over again, or do we just take the second shot, or do I forget the second shot?
No, I'll answer that. You do not forget the second shot. You go get that second shot. You have time. If you missed the exact day, there is a grace period where you can definitely get vaccinated. The current thinking is that could be as long out as 6 weeks, but we don't recommend it. There's a 4-day window you have right after that you should try to get your vaccination in that window.
Thank you for that. So, Dr. Sharfstein, I want to get these numbers. I know the pressure out there. I have friends that live in other states, and they were eligible to get their vaccines at an age when Marylanders were not eligible to get. So you could state shop here and find more lenient states, and I understand the pressure on the governor to open up as quickly as possible to broader groups. So we opened up to 1A initially, which were the frontline health workers, nursing homes. That were our first group. And we did a fairly good job, although there was certainly not there's still a percentage that never got their vaccinations during that window when it was open. Then we opened up that was on January 18th, we opened up to 1B, which was those over 75 years of age, those in congregate living, child care workers, and K through 12 educators. And then 1 week later, we opened up to 1C, which was 65 and older, critical services such as grocery store people, transits, and things like that. Now, we certainly opened up 1C before people in 1B could get fully vaccinated, those who wanted to get vaccinated. So we already put in line more people than we had the vaccines to accommodate. The total vaccinations that Maryland has received as of January 26 is 702,000 doses. Now remember, you need 2, but the 702 is the total number we've received. 95% of that's been delivered. That seems like a pretty strong number, but only 60% are actually in people's arms. So my question to you is, the system seems to be pretty chaotic. There's a lot more demand out there, people who want to get the vaccination, let alone people we haven't yet done the outreach to convince they need to get the vaccination, than the vaccinations that are available, which causes people to spend a lot of time trying to get appointments and shopping as many different places. As we're all aware, you can get the shots at your county facilities, health officers, locations, or you can go to hospitals that have vaccinations that you can get an appointment with. and soon we'll be opening it up to pharmacists. So it just seems to me it's the luck of the draw rather than it is an organized process where people believe they're being treated equally.
Well, I think that's true. One of the mayors that I was just talking to said it's like trying to get Super Bowl tickets. And something that's so important for health shouldn't feel like, getting concert or Super Bowl tickets. And there are a few problems for that. First of all, it feels unfair. It's incredibly frustrating. And also, people who are it's inequitable in that, if there are 12 different websites to go to check for a vaccine, some people don't even have the internet. Some people don't have children who could spend 6 hours looking for a vaccine for them. And so it winds up being pretty unfair in that regard. And so it's very unfortunate that we're in a situation where there's so many different paths to the vaccine that it's very hard for people to know whether, what to do. And it seems very capricious what winds up happening. I think the path forward, I think it's going to be jumbled for a little while here. I think that the state needs to help. Because the state's really coordinating the distribution of vaccines, sets standards for all the different places for vaccinating, how they can make a fair process. So even if you can't have one big fair process, at least you could have a few, fair processes. Every single place that vaccinates should provide a mechanism for people to get vaccinated, to get on the list without, using a complicated website. That should just be a requirement if the vaccine is going there. And then I think the counties with Dr. Carter should be able to say, here's the vaccine the county's distributing, here are the other sources of vaccine out there, and here are the fair ways that you can get on the list for those as well. So even if it's not one list, one approach, maybe it's 4 or 5 or 3 in a particular area, but it's much easier for people to understand. And there are avenues for getting there without it being too technologically complicated. The other point that I would make is, in addition to those paths, I would call that the mass vaccine strategy, getting as many people who are ready for the vaccine right now vaccinated. You got to do that fairly, just like you said. I think every place should have a focused strategy, really looking at the map, saying, here are communities that have been very hard hit by COVID-19. What are we going to do to really help them have access to the vaccine? Because we don't want it to be that they get left behind again, really. And that could look like a mobile vaccine team, a special clinic in a community health center, like what is being planned there. And I think at the state level, they should be able to explain their focus strategy, not just their mass vaccine strategy. And I'm sure Dr. Carter is thinking of things. I know Dr. Jaraza in Baltimore City has been planning a mobile vaccine strategy to address some of these areas of the city that she really wants to make sure don't fall further behind.
Great suggestions. My guest today on Facebook Live is Dr. Josh Sharfstein, the Vice Dean, Public Health Practice and Community Engagement at Johns Hopkins University, and Dr. Ernest Carter, Prince George's County Health Officer. And we are discussing the vaccine distribution system to try to deal with the COVID-19 virus. And Dr. Sharfstein, you've given us some really good suggestions, and I want to follow up with Dr. Carter. You suggested that some think it's as difficult to get an appointment as it is to get a Super Bowl ticket. Well, if you look at who attends the Super Bowl traditionally, it doesn't represent a cross-section of America. It's those who have the wealth to be able to afford the cost of a Super Bowl ticket. Now, there'll be an exception this year because the Frontline Workers are getting the Super Bowl tickets. So this is a year in which we've used an innovative system within the NFL to make sure there was a fair representation, which means why aren't we deploying a similar strategy to make sure that the traditionally underserved community or vulnerable community is not the last in line, but have a chance to have the vaccine in a timely manner. So what is Prince George's County looking at to do in order to reach the communities that otherwise would have a hard time getting a service and getting the vaccine? Dr. Carter.
Well, I think Dr. Sharfstein hit the nail on the head. We have a strategy for getting it to folks who have a hard time getting the vaccine. We have 3 mobile units. They go to not only to shelters, but we're currently gearing them up to get to housing projects and other places where we know folks will have a hard time getting there. The mass vaccine centers that we stood up, we realized that that's very difficult for people to go to. The state has been working with pharmacies, especially in grocery stores like Giant and Safeway, but we're making sure that they pick the Giants and the Safeways that are in the communities of need, as well as in the more affluent communities, but particularly in the communities of need. And we are mapping out where the need actually is and where the paucity of vaccinations are occurring. Now, I want to be clear, though, there is not a lot of vaccines and we don't have, well, at least in Prince George's County, we haven't got a lot of vaccine in Prince George's County, and most of the local county the health departments have really burned through most of their vaccine to this point. They're in second doses. We're just a bit behind, but we're at the point where we're doing 1,200 vaccines a day. So we know how quickly we'll burn through our supply and then the second doses. And there's not a lot of doses coming in now. I mean, the flow of vaccine into the local health departments is very low right at this point. Now we're hoping that, of course, it increases with what President Biden said, getting an increase. So we're hoping that wherever the paucity of, if there's more vaccine in places, like our hospital systems have really stepped up, they're starting to vaccinate a lot more folks, and after they have vaccinated their people. But right now in our system, I will tell you, there's just not a lot of vaccine.
So without a lot of vaccine, there's going to be frustration because people are going to want appointments who can't get appointments. And although you want to do outreach, it's hard to do outreach when you don't have the vaccines to be able to give it to the people that you're doing your outreach. That's a very challenging situation.
Yes, it is.
At lunch today, the Democratic members of the United States Senate got a briefing from the Biden team on their strategies to deal with the COVID-19 through this emergency legislation that we'll be considering next week, as early as next week. We're not going to get it finished next week, but we will start the considerations next week. There were 3 principal priorities in the COVID legislation. One is to provide resources to produce and distribute the vaccine in the most effective way with the largest amount of doses possible to get out to the states. So that was the first strategy. The second strategy is to help those families and businesses that are most at risk during this economic downturn in order to be able to, people can get through the COVID-19 with food on their tables and a roof over their heads. The third priority was to get schools open safely. And that's a challenge. And vaccination is part of that. In Maryland, the educators are in the 1B category, which means they're eligible for vaccinations now. So what do we need to do in order to be able to get schools to open safely as part of a vaccination program? Does it require us to vaccinate every person who enters into that school building? I know young people, there's certain ages that they're not eligible for the vaccination. I recognize that. But how does vaccination play into the priority of getting our schools open as quickly as possible and as safely as possible?
So, is it okay if I go first?
Sure, Josh, you're up.
Okay. First of all, I think this legislation is very important, and I would point out that that second area that you mentioned of just financial support is actually really important for disease control also. If people don't have enough money for food, they have to go out more frequently, they're going to be outside, they're going to be in different settings, they could be passing the virus around more. If people are out of a job, they may be, unable to support their families, they're going to be fighting to open up certain venues faster than is safe, so if you can get that economic support, it actually helps with the disease control too. schools are very important to open as fast as can safely be done, because children have been suffering, many children have been suffering both educationally and socially for schools being closed. And there are all kinds of consequences. Food insecurity is at just record levels, incredible levels among children, where they're going hungry. Schools play a really important role catching cases of mistreatment of children, and that's been lost. As well as major educational losses for a lot of kids. So it is just extremely important. There was just a report from the CDC published in the last couple of days, finding that with a lot of precautions in most places, schools can open without a very significant risk at all of transmission within the school. And so that's why there are a lot of schools open. And I'll point out, there are a lot of schools open in Maryland. They're private schools, but there are a lot of schools open in Maryland. And the question is, how do you put in place protections for smaller classes and masks and other things that actually get you to very, very low rates of transmission, which a lot of school systems have been able to do around the country and even in Maryland. And there is more money coming from the legislation you passed at the end of December that is going to help school systems do that. There's even more resources that would come in the new legislation that's been proposed. But my answer would be that I think I think it's important for schools to be moving to open. Vaccines play an important role too. I think they add to the confidence of adults that they won't get sick, but it's really everything that's being done that creates that confidence. And the track record of schools opening with a lot of protections, as long as the community rates of transmission are within reason, the track record is pretty good. And I think for it should be optional for students, obviously, because people have different levels of risk. And so some people will want to keep their kids at home. And I think certainly for teachers with risk factors until they're vaccinated, I think it very much should be optional for them too.
And thank you for pointing out, and they did at lunch today, it was a virtual lunch, by the way, that there's a lot of factors that go into being able to open a school safely. And vaccination is part of their strategy, but it's also the ventilation system of the school. It's the size of the school and their ability to distance. It's the transportation issue to get the children to the schools. All of that, and testing, all that is part of a strategy for the safe opening of schools, and each circumstance is somewhat different. So there is not one size that fits all on schools being able to open safely. Dr. Carter, are you aware of what's happening in Prince George's County and what they need in order to get their schools open?
Yes, sir. I am aware of what's happening because we are working very diligently to get all of our teachers in the public school system vaccinated, and then to work on the teachers in the private school as well as people in daycare. In child care. We recognize the same thing that Dr. Sharpstein has pointed out. And we're working very diligently to be sure that we get the teachers vaccinated. Not only the teachers, but the people who work in the schools. One of the things that we know that is important about our school system is very large. It employs a lot of our folks. And they have, of course, families and their grandparents there. And if there is, it turns out that it's not when it is transmitted in the school, it's transmitted amongst the people in the cafeteria and working, et cetera. So if we can vaccinate those folks, we feel that that's just another major way of decreasing the spread, especially when we try to get those schools open as quickly as we can. So we're of the same mind, we're of like mind, and we have a clear strategy for doing that. As a matter of fact, this weekend is our weekend to vaccinate a lot of our teachers.
And it goes beyond just our schools. We have a lot of essential workers, a lot of workplaces that we have to be very aggressive in trying to deal with how they can operate safely. And I know that's also part of the state priority strategy, but needs to be implemented at the county level. So it's not that easy. I'll just mention one of the areas that was brought to our attention by the Hogan administration, that we have a lot of federal agencies that are located in Maryland. I know that Dr. Sharpstein's aware of that. their workers, and many of which are frontline workers. The federal government only provided for a small fraction of the federal workforce to be included under the federal allocation. So we are struggling on how we're going to get that workforce safe to do their essential missions within the allotment given to the state of Maryland. So these are some of the challenges that we're all facing and trying to figure out how is the best way to allocate this. I will mention one thing that I think is critically important and has been missing to date on how we're dealing with this, not at the county level, certainly at the national level, and not as good at the state level as it needs to be, and that's transparency. We need to let the public know exactly how we're handling this so that there is confidence, as Dr. Carter pointed out, there's confidence and credibility that the system is working the way it should be working. I think all of us can understand there's a great deal greater demand than vaccines that are available. We get that. And we understand there's going to be a priority system for who gets the vaccines first. Everyone accepts that. But within that, there is a mass lack of information as to how people access to get their proper place in line to be able to get that vaccine. And that is something that really needs to be addressed, I think, moving forward, if we're going to have the support of the public. Because as you know, we're going to ultimately get to the phase 2 and phase 3. Phase 2, those individuals at high risk that are under 65 years of age that were not included before. And then phase 3, which is the rest of eligible individuals. And that's going to, again, open up a challenge because even under ideal circumstances, the capacity we're going to have in this country to give vaccines is going to take a period of time before we can deal with the demand. So we need to have transparency.
Yeah, if I could point something out, I think you're absolutely right. I know one of the priorities for the administration around how much vaccine there is to give everybody more visibility into the actual supply. So it's not that things were promised and don't arrive, but people can really see what's happening. I point out that there's one area of the response where there was transparency and it worked out pretty well. And that is transparency about the data for the vaccines. In other countries, the government has said, oh, we have a vaccine, everybody line up and take it. And it was totally unclear whether and how the vaccine had been studied. I'm thinking of Russia, for example. In the United States, the Food and Drug Administration got the information, reevaluated the data from the companies, put out comprehensive information, had a public meeting where experts, public, thousands and thousands of people watched, all the journalists covered it, and everybody really dug into what the data was about the vaccine. And as a result of that transparency, people, there's broad understanding of how effective these vaccines are. And whereas in other countries, people don't even, know what to trust or who to believe or how it was done. And I think it speaks to your larger point that when government can share the data, what the decisions are based on, when they can have public meetings where people can ask questions and questions are openly debated and discussed, then people can understand better. And I think it's given people a very strong reason to understand the safety and effectiveness of the vaccines.
So I want to go back over the efficacy issue that you talked about so people recognize when you say 95%, what does that mean? And I also want to go over the risk factors that we talked about before, but the risk factors of getting this virus. Obviously, if you are older or have compromises in your system, the percentages are much, much higher. But even for those who are younger, who have no apparent weaknesses in their immune system, we have seen some really very, very bad outcomes from those who have gotten the virus, including what we call long-termers. They go a long period of time with symptoms, and we don't have enough information to know the final impact they may have on the strength of their organs as they get older. So there's a real high risk factor for anyone getting the virus, whether you are a teenager or whether you are a 75-year-old. So the point I want to go over again is the efficacy. What do you mean by that? When you say 95%, does that mean that once I get these shots, I'm free, that I'm not going to get sick, and I can go out and socialize and do everything I want to do. What does it mean, the efficacy issue, and why does that help you, but also helps our community? Dr. Sharfstein, I'll give you a first crack at that. What does that mean?
Sure. So basically, it is a sign that the vaccine provides a very high degree of protection, but not perfect protection. So people still should be careful while there is so much virus circulating in the community. Let's take a group of people, of whom 100 of them were going to get a case of COVID. If they're all vaccinated, only 5 of them will get COVID. That's a 95% reduction. And so it makes any individual is 95% less likely to get COVID compared to their risk before. So that's the basic understanding of that 95%, and it's a pretty strong drop. When vaccines were getting originally studied, the FDA said they would be happy with a vaccine that provided a 50% drop, but it turned out to be 95%. So it's very, very strong. And those are for cases of COVID where people actually get sick. They did look in the studies to see what about the very severe cases of COVID, the deaths, the hospitalizations. For the Moderna vaccine, if memory serves, there were 30 people who got that sick in the trials, and none of those people got the vaccine. So they were all in the placebo group. So the reduction was complete for severe cases of COVID. In the Pfizer trial, I think there might have been one person who was in the hospital for a bit and went home. And so for severe COVID, it looks like it's a very strong, possibly even better than 95% reduction. So the evidence is just very, very good for a huge reduction in the risk. But like you said, it's not zero. We want people to still take precautions while there's a lot of virus. But as more people get vaccinated, then there will likely be less virus circulating. Now, it doesn't make it, if you're vaccinated, you could still carry the virus and bring it to someone else, but the chance of that is going to be less, we think. And more data will be coming about that soon. And overall, with fewer people really infectious, coughing, making all kinds of people sick, the virus will go down. We add on other types of public health protections, the virus will go down even further. And eventually, it's not the individual getting vaccinated, but the virus going down that allows us to start to regain a sense of normalcy.
Dr. Carter, I've been told that even though you're vaccinated, you're supposed to wear your mask and be distanced from each other. Why?
Well, just like Dr. Sharfstein just said, we don't know whether or not you can still spread the virus. So although you may be protected, you may spread it to somebody else who's not protected. So you have to continue to wear your mask. That's very important. And doing all the other things, staying 6 feet and keeping your surfaces clean. Those are all very important things, because the virus could still spread even though you've gotten your immunity. So that's the most important part of that.
And if as soon as I get my first shot, am I at a level that I can feel a lot more comfortable? Or do I have to wait till I get my second shot before I'm at that level where I think I'm feeling more comfortable? Or do I have to wait 6 months after my second shot before I get the maximum amount? Where are we on this chain? And this is, I guess, more for your mental.
Yeah, I'd say 1 week after the second shot is what they did. That was what they studied, 1 week after the second shot.
Oh, thank you. I didn't know that answer. That's good.
That's true. Yeah.
All right. So that's a question that we're asked frequently. So I can add that to my knowledge base. I appreciate that very much. So we talk about herd immunity. I don't really understand herd immunity. I've heard it explained a couple times. But ideally, to try to get this virus under control, what percentage of Americans adult Americans, do we really want to see vaccinated in order to think we can deal with this? And I want you to put into this equation, we've seen mutations develop, some of which strains are said to be much more contagious than others, maybe not more dangerous, but spreading a lot easier than the original strain. Does that make it even a larger number we have to deal with to get herd immunity? Does the herd immunity apply to mutations or variations of the virus? what's our goal here? Dr. Sharfstein, we'll start with you.
Sure. The goal is to reduce the amount of virus circulating out there. That's what allows us to go back to doing some of the things that we'd really like to be doing right now. That's the goal. Now, the idea is if enough people are immune, then the virus just can't keep spreading. You know, the virus survives by jumping from person to person to person to person. But if a whole bunch of people have been vaccinated, the virus just has no place to jump to and really has a hard time passing around in a population. That's what people call herd immunity. Now, well, how many people need to be vaccinated for that? That depends on a bunch of different factors. And so people are estimating, guessing what that'll look like. Some people think it might be 70%, some people say 80%. The issue with these new variants, one of the issues is that if it's much more infectious, then you need to have a higher percentage of people vaccinated to get to that population level of immunity. And some people say maybe you might need 80 or higher percent actually vaccinated. So the important thing right now is to vaccinate as many people as possible, and then we'll be watching. I'll point out, though, that it's not just vaccination. If we can have good public health controls, that'll make it easier to drive that number down and allow for greater reopening of our society and that sort of thing. So it's both vaccination and the other things that Dr. Carter mentioned that are going to be really important for success. Now, a lot of people wonder whether the vaccines will handle the variants. Right now, all the evidence is yes, they will. But the good news is the virus, while it is a very crafty and destructive virus, the virus we can keep pace with, and it's possible to develop vaccines to the new variants relatively quickly, and the companies are already working on that just in case the variants look like they may escape the vaccine. So there are, this is going to be a battle, a continued battle between humanity and the virus, and we have other tools to bring to that battle too.
And Dr. Carter, you mentioned, rightly so, that what our leaders do is such a powerful message to the public of what needs to get done. I think you're going to see a very, very clear message coming out of the Biden administration as to what we need to do. Both of you have mentioned wearing masks. You're going to see that underscored by our leaders. We now have, of course, a mandate in federal buildings. We have it in the Capitol. So we're going to lead by example. We think that will do a great deal to help control this. So I think your leadership in Prince George's County has been particularly important. And I just really want you to know that we're going to try to follow your example at the national level and give very clear direction. But let us know what you need at the county level. We're going to try to help you in this next bill. And there's help coming in regards to the omnibus bill for the counties.
Thank you, Senator Cardin. We look forward to it, and we know you have our best interest in mind. You always have, and we're looking forward to getting the funding that we need, and we will make sure that we keep our county citizens protected.
My understanding is there's about $54 million available through the omnibus bill that we passed that will be coming to our counties for the vaccine issues. And it's a major part of President Biden's proposal that he's made to Congress. So let me thank, I started by really saying to our two guests, you're our heroes. You've done an incredible service to our country, to our community. We thank you for your frontline leadership and for your lifelong commitment to public service. So let me once again thank Dr. Josh Sharfstein, the Vice Dean of Public Health and Practice and Community Engagement at Johns Hopkins University. That's a long title, at Johns Hopkins University. And Dr. Ernest Carter, who is Prince George's County's Health Officer. Thank you all for joining us today on Facebook Live as we've been talking about the vaccine distribution. Stay well, everybody.
Thank you very much, Senator. Good to see you, Dr. Carter.
Good to see you too. Thank you, Senator.
Thanks.